Hello. Tyler Knoll, hello. Hello, my lovelies. Ba, 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 ba. How are you guys? OMG, it's a live stream. I know, right? Bone, congratulations on getting first. First. Hello. Hello. Okay, I'm getting... What is that? I'm getting a tomato in my face. Guys, I'm so excited. I finally have a new monitor. Ah, I have a new monitor. Guys, I have a new large monitor. Okay. Sorry. I had to like reposition myself. I have a new large monitor. Isn't that exciting? I'm so exciting. I'm so exciting. I'm so excited. I'm excited. I'm excited. Large. Yes, it's large and in charge. My new monitor is large and in charge. It's like a 24-inch. I'm so excited. Guys, I have never had anything larger than like a 17-inch laptop because I've never had like a full-on PC before. This still isn't a PC. It's just a monitor I've connected my laptop to, but still. It's still pretty good, huh? Now I just need like an actual PC and then I'll be like super like official, you know? It's progress. Slowly but surely we're making progress. You know, I'm like not in a what's it called? I'm not in a closet anymore, which is nice. Thank God. Yeah, so I'm not in a closet anymore. I'm not like reverbing. I actually have a chair now. My chair has a back. Isn't that crazy? Oh, I don't know if you guys knew this, but I used to stream like in my old place where I streamed. It was basically a closet, and it also was on a stool. I was sitting on a stool. Sitting on a stool in a closet. Yep. Moving up in the world. I know, literally. OMG, I'm streaking. Hi, Kimi. Thank you so much for the streak. Ba, 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 ba. Ba, da, ba, da, ba, da, ba, ba. Ba, da, ba, da, ba. We are streaking. I like turned on my audio monitoring, because I was wondering how I sounded, and I think it sounds okay. I think it sounds okay. It's really hard to tell. I'm gonna be completely honest. How is your day going though? It's going good. My day is going well. I like how that looks better. Tisk, tisk, tisk. Maybe not this. Wait. Let's see. Maybe... Where's the lighting effects? We're looking for the lighting effects. Do, 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 do. Aha. Presets. This? Oh my. Blue lighting. Moonlit sands. Oh. That's pretty nice. Okay, yeah, I like this. We are at night, and I have a moonlit sands effect. Oh wow, and there's little sparkles too. That's nice. Wow. Let's see. Aha, and a little bit of blur. Maybe a little more. Oh, whoa, Lev, I hope you're ready for the grub pictures. Oh, grub, like food? Wait, I love food pictures. So, yes. We definitely need more. We need more. Like food pictures. I love food. No, like a baby beetle. Grub like for your pet? Hello, love. Hi, Kami. Floaty particles. Yes, I would like. Ooh, light spheres. Okay, maybe not that many light spheres. Turns out they are grub worm pictures. I know, I was like, grub, like grub hub, like food for me. Light spheres, bobble. You see them on the screen? You should see them on the screen. Like these little lighting effects. It's fun. Go grab some grub. I'm all alone, ooh, and now I know. Darling, there's no heaven is mine. My love has wings. Ooh. Okay, we're done with that. Today it's nighttime. Oh, I have these. Okay, I think these are too many. I feel like I've decided I don't like these light spheres. Okay, you can have that many. 0.02 many. Hi, Kami. Hi, Calcium. Oh, I love when you guys talk to each other. It's very cute to me. I'm like, oh, they're making friends. Do psychiatrists count your vocals as medicine? No. No, no, they don't, unfortunately. No, they don't count it as anything. Yeah. My singing, if anything, is just like, I don't know, weirdness. A weird hobby that I have. Dum, dum. Dum, dum, dum. You have new test results. Ooh, okay. I got labs done recently, so hopefully this isn't gonna tell me that like I have horrible, horrible labs or something like that. Sounds like music therapy to me. I mean, that's like, that is a thing. It's not a thing that I'm trained in at all. Unfortunately. I wish I was, though. I think that would be like really fun to be good at, but unfortunately, yeah, ba 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 ba. Do 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 do. Nikoi sipi. Hi. Ohayo. Hello. Thank you so much for your first time chat. Your voice is very relaxing. Thank you. That's the goal. Unintentionally, I think I've cultivated a kind of like sleepy vibe today. There usually is a bit of a sleepy vibe, but I think today in particular, there's like a big sleepy vibe, you know? There's a lot of different types of therapy. Nep is wanting to do horticultural therapy. Oh, that is cool. That is very cool. Nature therapy is a big thing. Oh, thank you so much, Nico. Oh, Nico is Eepy. Oh, I see. Nico, thank you so much for the follow. Any advice to get over my fear of getting a new PCP? I don't really like my current one. Ooh, I mean, I guess it depends on what the fear is, right? Are you afraid that your new one is going to be also one that you don't like? There's like, I have a lot of social anxiety, or I've had to work on my social anxiety a lot. And a big part of it is like a fear that someone's going to be mean or they're going to judge you or whatever. And like, there's two ways to it, I think, personally. There's like the whole, or maybe 3 ways. Yeah, I think there's like 3 perspectives when it comes to anxiety, right? So one is, can I reframe it in a way that makes my anxiety less legitimate, or like restructure how I'm thinking about this, right? It's the, I'm so anxious they're gonna judge me. And then the response of, why would they judge you? There's no reason to judge you. They've probably seen worse, right? The reframe it so it's less anxiety inducing. So that's one approach. Another approach is to make the anxiety itself less scary, to be like, yeah, maybe they will judge me. So like, that's okay, right? Like to be like, oh, this anxiety that I feel of maybe they're going to be judgmental, maybe they're going to be weird, this uncertainty, like that's there, but I will survive it, right? Like this anxiety is going to happen, but I will be okay. Right. So it's like, I'm going to feel anxious, but anxiety won't kill me. Like it'll be okay. So that's the second approach. Like you don't need to be this anxious, but also even if you are anxious, it'll be okay. And then the third approach that I think about is like, what about this specifically makes you anxious? What about like, where do you think that comes from? Why does it like a sort of more like personality past a subconscious-y psychoanalytic kind of approach, right? Like what does it remind? Sorry, to be very, 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 very stereotypical, like in like a, oh, well, does it like, is it that you had authority figures early in your life that were very judgmental, and so you have a fear of that, or blah, like things like that, like this sort of root cause. basically they'll judge me and okay, and I mean, that's the thing, right? Like there's two parts to it personally, right? Which is, yeah, maybe they will judge you. They probably won't, but even if they will, even if they do, that's fine, you know? Who cares? Sujo, thank you so much for the scribe. For the scribe, thank you so much for the sub. Wow, I like totally did not read the first part. Thank you so much for the sub. You're on a 12-month streak. The boundary of I am a doctor, but I'm not your doctor is really good. Oh, thank you, Nico. Yeah, no, I try to like phrase it as like, I think I have things worth saying, worth listening to, but like I can't give specific advice or like guidance or directions, you know? Are they going to be notified they're no longer my PCP? They're totally going to judge me? No. Okay. So okay, if you're in the United States, if you stop seeing one doctor and you go see another doctor, the only way that the first doctor would know you're not seeing them anymore is if you like told them, if your new doctor reaches out to them for records, if it's in the exact same hospital system. But like if you go from one clinic to another, most likely it'll just be like, I guess this person never came back, and that's it. Also though, people switch doctors all the time. Like all the time. And having someone switch from like seeing me to seeing someone else, and it's just like, I've just decided to see someone else. Literally, I don't think I've ever heard of that bothering anyone, because like some people will switch in like a, you're terrible, you're the worst doctor I've ever had, I hate you, I hope your business burns to the ground. Like, you know, people will be very rude and very mean, and like even that I can like kind of accept. So like really it's fine. I have fairly moderate high social anxiety. I get that. I've had really bad social anxiety in my life. Like to the point that when I was working overnights, nothing would happen and I would still be anxious for 12 hours straight because I was so worried that like someone was going to call and ask for something and I wouldn't know what to say. So I would like I would basically run through a bunch of contingencies in my head of like all the different things that anyone could possibly ask me when I'm on call overnight and what the answers would be. And like, I remember I knew I needed to go see a psychiatrist myself and get on like meds and get into therapy when nothing happened overnight. And the people I was signing out to, like the residents I was signing out to in the morning, were like, Lev, oh my God, nothing happened. You must have had such a relaxing night. You must have like gotten so much sleep. And I was like, actually, no. I was like refreshing the EMR, the electronic medical record, like every 30 seconds. I was sitting in front of a computer refreshing it every 30 seconds for 12 hours. And I was like, maybe that's a sign that I should try to manage my anxiety somehow. So yeah, no, I get it. I'm also, you know, I think I'm just constitutionally, like my baseline temperament is extremely anxious. Okay, guys, do we want to start? Do you want to start? Lower left. Okay. Oh. There we go. Anyway, how are you, Lev? I'm good. I'm good. Thank you so much, Sucho. Okay. Guys, aren't you proud of me? I'm like totally prepared. Sorry, I just need you guys to look at that. Like I moved my model to the bottom right and bottom left for my screen, and we turned on the doctordle thing and it's already up and it's already sized properly and it's like in the background. But isn't that great? Guys, I'm like actually so prepared today. I'm so proud of myself. I'm so proud of myself. Oh, thank you for the headbands. Proud of you. Thank you. Okay, so really, it's true. For all the years I've had psychiatrists, I get switched at most every year and or half year. Oh, you switch psychiatrists often? Okay. I wish my doctors were more permanent in a way, because then you got to explain again and again. That can be a bit frustrating. No, it's super frustrating. I totally get it. I think especially for psychiatrists, are you at a place, like, do you see your psychiatrist at a place that has a really high turnover? Because I know that any of our patients that see psychiatrists at like a resident clinic where it's like you're seeing people that are training to be residents. You're seeing residents that are training to be full-on psychiatrists. So obviously, like, it's a 4-year program. So you do year 1, year 2, year 3, year 4, year 3, you're usually in the clinic. And so a lot of those patients will have a different doctor every year, because it's like this year graduates and then they pass you on to the next year, and then that year graduates and they pass you on to the next year, right? And so that can be like high turnover. But other than that, what I do tend to hear about, especially with older doctors, is like, oh yeah, I've had my patients, the same patient I've been seeing for like 15 years. And I'm like, that's crazy. So psychiatry, I guess maybe if your psychiatrist leaves a practice, that also can be a thing. Like, not just training, but there can be high turnover at some like private practice areas, especially if it's like, I don't know, especially if it's the sort of thing where maybe people don't want to stay for that long. But prepared, big monitor, everything is coming up live. I know, I have a big monitor. Now I'm super prepared. And now we're doing doctordle, which I have never played on my own. Wait, that's not true. I played once and it was really, really, really bad. I was not good at it, but we will do our best. Boom, boom, boom. Okay, what's the diagnosis? A 12-year-old girl presents to the pediatrician for follow-up of a sprained ankle. Guys, I'm confused. What is this meant to... She's following up on a sprained ankle. What is there to say? I go to a mental health center. I talk to psychiatrists on video calls and see my therapist in person. I also get my medication prescribed and ordered there. Oh, is it like one of the... here, I don't know what we would call them, like one of those like agencies for like public, like community psychiatry, because those do tend to have high turnover, unfortunately. But hopefully, I hope you get someone that stays for a while, because that's honestly always the best. Clearly she has COVID, lupus. Also, lupus is spelled I think LUPIS is like more like lupine, like wolf, right? Clearly she has COVID. I guess, see, this is terrible. My first thought, I'm just like, why is she coming back for follow-up? Because oftentimes if it's a sprained ankle, like if it's a sprained ankle, I feel like you just go home. Like, why are you following up on it? So is it that her mom is really anxious and she's like a hypochondriac? Is it that her mom is like seeking attention, or she's seeking attention and it's like a Munchausen's thing, like a Munchausen's or Munchausen's by proxy? Or is it child abuse? I don't know. Vulnerable child syndrome. Physical abuse. Okay, what are the other options here? Wait, let me make this... There we go. The bat bit her ankle and that's why it's sprained. It's sprained. It was broken all along. Oh, let's see. Ankle. Nope. Joint. Acromion. Sends to the pediatrician. You know what? We're going physical abuse. This is terrible. No, okay. Her mother reports the patient has always been clumsy, but she has tripped and fallen more frequently in the past year. Okay, well, that also would have made me concerned for like child neglect. So I'm glad we've ruled that out. Although let me just make sure. Neglect doesn't come up. Okay. Hernia, big. I know she's got ankle cancer. I don't think ankle cancer is a thing. Bone cancer is a thing. But tripped and fallen more frequently. There's something wrong with her nervous system then, probably, right? Tripping and falling. Like, what are the reasons that people trip and fall, right? Like, a lot of the common ones that we think of in adults are not things I would expect to happen in a kid. Like if they're like having weakness or some kind of like what's the word? Like lightheadedness or like some heart thing. Like those are things that we think about in adults, but I don't think that would happen in a kid. So if she's losing her balance, like the things that help us balance, like, yeah, like Kat says, like an inner ear thing. Our inner ear helps with balance. It's the middle ear, like the rings. Wait, have you guys ever actually seen what your middle ear looks like and how it like the vestibular system is what it's called, and like how it actually keeps track of where your head is in space and stuff? It's super cool. It's very interesting. Anyways, so it could be inner ear stuff. It could be eye stuff. It could be like she can't see. It could be she's having trouble balancing, so that would be like cerebellum stuff, like that part, the extra wrinkly part of the back of the brain is the cerebellum. Let's see. Right. What is I'm like trying to think of like what is the word for like you need glasses? Myopia, right? It's why is myopia not on here? Okay. I still think polio. No. Cerebellar. No. Okay. And she's not having a stroke. She's not having a stroke. She's 12. There's no way it's a stroke. Okay. For a sprained ankle. She's tripped and fallen more frequently in the past. Ligament tear? I mean, but I think what I'm thinking is that there's some reason she's been tripping and falling more, right? Let's see. What is that nerve called? Oh, God. I actually did learn about the vestibular system. It's one of the few medical things I know about. Yeah. Also, I love that you have a placeholder username still. Let's see. What is that nerve? It's the nerve on the outside of your leg. Peroneal nerve palsy. Okay. Ataxia may work. Unfortunately, okay. Friedreich ataxia and ataxia-telangiectasia. I don't think either of those are correct. Palsy. I'm very confused. Vagus nerve. No. I was thinking like a peroneal nerve palsy maybe, but the thing, yeah, no, I know. I'm so helpful. There's a kind of like nerve palsy that you can get, which basically like if you wear like high and tight boots, it can press on the nerve that runs down the outside of your leg that holds your foot up. So then your foot will drop and you'll trip over your feet. But that doesn't seem to be what's going on here. Yeah. Guys, this is hard. This is one of the questions of all time, Lev. I have obvious things that I could say, but I don't want to say them. Also, the things I would say are not answers on here for some reason. I'm very confused. Honestly, in a real scenario, we should press for more information. I know. Let's see. Okay. Nope. Developmental dysplasia is not it either. Dyspraxia isn't on here. Tummy ache. Okay. All right. Neku-chan, formerly Zanza. Zanza, thank you so much for the sub. Thank you for the 7 months. She clearly is drunk. That's why she's stripping. Oh, let's see. Okay, intoxication. I don't know about that. Factitious disorder imposed on another. Or intracranial non-communicating hydrocephalus. Communicating hydrocephalus. Oh gosh, I don't actually know. Intracranial. Like pseudotumor cerebri. Oh my gosh, 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 oh my gosh. Thank you so much, Zanza, for the 10 gifted. Whoa! And the hype train has started. Thank you guys so much. Thank you guys so much. I know she's trying to get more perks. Maybe an ear infection. Ah, yes. Let's see. Inner ear. Nope. Ear. Ear. What's... Guys, why is this hard? Okay, you know what? Let's just say intracranial. We'll say it's pseudotumor cerebri. I don't know. It's not. Oh, maybe ear canal balance thing. That's what I was trying to figure out. But like when I try to do ear, it just doesn't say anything. Oh, what is... It's like some kind of subfalcine, like this? No. Oh god, this is some genetic thing, isn't it? Guys, it's some... This is some congenital thing that I don't know what it is. Okay, medical history, significant for scoliosis. Lower legs are narrow with a champagne bottle appearance. Her feet have high arches. This must be some kind of champagne... Guys, look up for me, please. Champagne bottle appearance legs. Well, it's not scoliosis because it already says that she has scoliosis. She has some kind of developmental problem. Clearly. Is it like a vitamin D deficiency? I don't think it's a vitamin D deficiency. Like... You mean like rickets? No, that's different. Lipodermatosclerosis? I don't think that's it either. She didn't eat her veggies. No, guys, you're so unhelpful. Okay, let's see. Champagne bottle legs. Oh, is it lipodermatoscoliosis? Lipodermatosclerosis. Friedreich ataxia could work if not for the leg stuff. Yeah, that's what I was saying. Lipodermatosclerosis. I try to help and you say no, but like, the lipodermatosclerosis doesn't exist. You know, please select a valid disease. It's not a valid disease. This is very annoying. Oh, 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 oh. Oh, I think I know what it is. I think I know what it is. I think I know what it is. It's, oh, frick. It's one of those eponymous things. Is polio valid? It's not polio. It's not polio. Okay. The reason that I'm pretty sure it's not polio is that polio is a nervous system problem. It's that like your nervous system doesn't work properly. It shouldn't cause like physical deformities in the same way. Most of the physical stuff, if my understanding is correctly, comes from like what's the word? Deconditioning. Yeah, like their legs waste away because they don't use their legs. If it's polio, then she would have been paralyzed. No, yeah, like polio, you would expect paralysis of some kind. There's different degrees of severity with polio. Not everyone with polio needed an iron lung. Those people needed iron lungs because the paralysis got to their diaphragm, like it got to their breathing muscles. No, this is one of those, oh, freaking like, what's it called? Charcuterie, charcuterie. Iron lungs aren't being used anymore. They're not because they look scary, but what we actually hear from people who had polio is that they were actually really helpful. It's one of those eponymous things, one of those like named things, not Wegener's. That's the nose thing. Charcuterie, yes, charcuterie tooth. Yes. Is it this? Great. Beautiful. What the fuck? Guys. Himiko, charcuterie board. I know, that's what I was like, charcuterie board. See, I kind of remember some things. I was like, it must be one of those like I'm bad at peds, guys. I'm not. I thought I wanted to be a pediatrician. I'm not peds. What is diagnosis summary? Charcot-Marie-Tooth syndrome disease is an inherited peripheral neuropathy. It's caused by genetic mutations affecting peripheral nerve myelin or axons. Okay. Common syndrome symptoms include distal limb weakness, muscle atrophy, and fatigue. Workup includes electromyography, nerve conduction, genetic testing. Treatment involves supportive care and physical occupational therapy. Okay, let me explain. Charcot-Marie-Tooth, this is names, okay? Peripheral neuropathy. Peripheral as in on the periphery, so like away from the center of your body. So your like fingertips are very peripheral. Your feet are very peripheral. Can I make you fan art random question? Well, yeah, of course. As long as it's not rude or has slurs, you know what I mean? Like just general basic etiquette. Not that I think that you wouldn't do that. But yeah, no, I don't mind getting fan art. I would be honored. Oh my gosh. Okay, peripheral. So like your fingertips are peripheral, your toes are peripheral, right? So that's why she's tripping, is that she has neuropathy in her legs, probably. Neuropathy is like a neuro as in nerves, like brain, pathy as in pathological, as in something is wrong, right? So like there's something, her nerves aren't really working in the peripheral parts of her body, right? And if you think about those nerves do two things. Those nerves move your muscles, like they do a lot of different things, but the big things is that there's sensation, right? So that's like feeling touch, feeling pain, feeling heat, feeling pressure, like from your skin usually. And then there's those nerves also help you move, right? Because if you think about like your fingertips or your toes, what are the big things that you need nerves to help you do there? It's to take back information about what it's feeling and to give it information about what it needs to do. So it's like What are you feeling? Do this. Those are the big things that those nerves do. So if those nerves aren't working properly, you can't feel your feet, which makes it hard to walk. And you also can't tell your feet to move, which makes it hard to walk. Hence the tripping. Common symptoms include distal limb weakness, which is what I'm talking about, weakness of your limbs, muscle atrophy, because you can't move your muscles aren't being used, so then they atrophy as in they get smaller. And fatigue, which makes sense. Workup includes electromyography, so electro like electricity, myo like myo in this sense means muscle. This is a, I don't even remember the etymology of it, but just know that in the sense it means a muscle. Myositis is like a muscle inflammation. So this is testing the electrical impulses to the muscle itself. Nerve conduction studies is testing how fast the electrical impulse travels in your nerve. So that's just like nerve to nerve, like from the top of your nerve to the bottom of this nerve, how fast does the impulse go? Electromyography was like is about, does it get to the muscle itself? Myo like myelin? No, that's different. Myelin is a different thing. Myelin, so what myelin basically is that it's like okay, think of your nerve. Let me explain myelin. Think of your nerves as if they are a hose, like a rubber, like garden hose, right? Your nerve is a rubber garden hose, and the electrical impulse, like information, is the water going down the garden hose, right? And you want that water to maintain its pressure and to get to the end of the hose as fast as it can, right? However, let's say that this garden hose at baseline has a lot of little holes in it, so it's kind of leaky, right? So you can imagine it takes a lot longer for water to get out the end of the hose if the hose is like a little bit leaky and is kind of leaking water also, right? So how do we fix that? You could cover the hose in like a kind of sheath to prevent the leakiness. So then all the water goes down. It doesn't come out the sides. It just goes down the path of the hose. And so then it comes out more. That's what myelin does. Myelin is like a fatty sheath around your nerve that helps make sure that the electrical impulses go straight down the nerve and they don't like leak out. And so because of that, it helps you to helps the nerve conduct electricity faster, basically, is the way to think about it. It's what makes the impulses from our brain move so quickly. I thought myelin did stats. I mean, myelin also does that. Ranvier nodes, rot. Yes, exactly. There's there's a lot of other parts to it, but you know, basically in terms of what a normal person would need to know. But yeah, because like it takes time for information to travel from like your brain to your spinal cord to your nerves to your fingertips, right? And so we want that signal and information to travel as fast as possible. Okay, well, loss of position and vibration. Okay, yeah, see? Okay, let's do the archives then. Because I actually haven't done these, so. A 67-year-old man in the intensive care unit develops decreasing urine output and rising serum creatinine several days after admission for severe pneumonia. That's not good. That's really not good. Oh no. Okay. Guys. Bro is dead. No. Okay, he's not dead, but he's not doing well. Kidney failure. So Yes. Basically, something is going wrong with the kidney. Clearly, right? So what am I thinking about when I look at this? Decreasing urine output. What does that mean? It means that, okay, so most people in the ICU are often like sedated in some way and intubated a lot of the times. They're like really like out of it. So, or they're like really deconditioned. Like they're sick enough that they can't get up on their own often. And so most people that I've seen in the ICU often have like a Foley catheter, like some sort of situation where like you don't need to get up to pee. It just goes into a bag on its own through a tube, obviously. So in any case, decreasing urine output. So if you're putting out less urine, usually, like where does urine come from? Like what are the causes of less urine output, right? So it could be that you're making urine, but your urine is not leaving your bladder. So there's some block between your bladder and out. That doesn't necessarily seem to be the case here, but it could be. It could be higher up. It could be something is blocking urine getting from your kidneys to your bladder, like a ureteral issue. Or it could be your kidneys are not making enough, are not making urine properly. They're not doing their job. They're not filtering blood. Or it could be your kidneys aren't getting enough blood to them, so they can't filter blood and can't make urine. Those are like the big ones I would be thinking about. So like, and rising serum creatinine is like a marker for kidney function. Your kidney is supposed to clear creatinine. So if your creatinine is high, we tend to think that this means your kidney isn't doing its job, generally speaking. Dehydration. It could be dehydration. Yeah, because or like severe, like we would call that hypovolemia. Hypo as in low, volemia as in volume. So like a low volume of blood, or like low, which would cause like low blood pressure probably and stuff like that, right? Like if you had no blood, less blood, then probably, not even probably, if you had less blood, then there's less blood going to your kidneys, then your kidneys can't filter your blood. Atherosclerosis isn't really possible right now. No, I don't think it's atherosclerosis. It would be strange for atherosclerosis to cause rapid changes like this, unless it's like a plaque, an atherosclerotic plaque, like detaches from the blood vessel and is like blocking something, and now you have a horrible blood clot. Could be that. Let's see. Well, he came in for severe pneumonia. Well, let's see. Does just kidney failure just... Yeah, no, I don't think so. Kidney stones. Pre-renal acute kidney injury. Let's just say, yeah. Nope. He recently had hypotension requiring vasopressors and received multiple antibiotics during his hospitalizations. Disseminated... Nope. Because I was like, he's septic. Yeah, does septic shock? No. God damn it. Yeah, since it can increase renin, no. I think it can. Again, it's just like, would it happen this fast, you know? Exam reveals dry mucous membranes, cool extreme... Oh, that's bad. And a Foley catheter draining only a small amount of dark urine. Like, hypovolemic shock? No. God. Lab studies shows increasing BUN with hyperkalemia and metabolic acid. Oh god. Only we think about metabolic acidosis. Okay, so metabolic acid. Well, see, you know what would be helpful is if I knew if he had an anion gap or not. Which is something I could explain, but I don't want to, because that sounds painful to explain. It was hard enough to learn. I don't know if I can explain an anion gap, Basically, metabolic acidosis means your body's acidic for metabolic reasons. There's different kinds. One kind causes an anion gap and another one causes an anion muscle failure. Oh, could it be, what's it called? What is that thing called? Rhabdo? But why would it be rhabdo? Could always go for cardiogenic shock to complete the circle. I mean, we could. Yeah, is it rhabdo? No. Ugh, God. It's not rhabdo, which, I mean, we would see more like a, like, oh, he had a seizure or something. So rhabdo basically is, rhabdomyolysis is kidney failure or like kidney function getting fucky because your kidney is being injured by the, like a huge amount of like muscle breakdown, right? Because when your muscle breaks down, it releases a lot of stuff that's hard for your kidney to clear. And so if you like exercise really hard, or like have a seizure, you know, like you overexert your muscles and your muscles start breaking down, it can like overwhelm your kidneys, and then your kidneys like go, oh my God, and that's rhabdo. Low urine osmolality is really weird. Rhabdo is like globs of protein all over the place because muscle breakdown. Yeah, exactly. Yeah, because your kidneys aren't really designed to like filter protein. Your kidneys are more for like, let's keep sugar inside the body. Let's get rid of nitrogen. You know, that's what your kidneys are for. Things smaller than proteins usually. ATN, I guess it could be acute tubular necrosis. Wow, Hika, thank you so much. You're the best. Yay, it's acute tubular necrosis. Intrinsic kidney failure, so acute tubular necrosis. Yeah, I know, you're right. A high fractional excretion of sodium and low urine osmolality despite worsening renal function. Yeah. Right, because so part of what your kidneys need to do is to balance the like salty levels in your body and the water levels in your body, right? Like part of your kidney's job is to try to keep you at an optimal amount of hydration. And so what that means is that if you are drinking like a shit ton of water, then your kidneys are like, okay, well, there's a lot of water, so we'll keep the salt in the body and let out a lot of this water, so you'll get really like dilute urine, right? But if you're really not drinking that much water at all, that's why your urine gets really concentrated, right? Because your kidneys are like, okay, we need to keep as much water as possible, so I'm only going to put as much water into the urine as is necessary to dissolve the things that we need you to pee out. Right, so it's meant to like balance in that way. So if, for example, in this case, this is what I think we're talking about. I might be wrong, okay? I might be interpreting this incorrectly. Kidney stuff is the bane of my existence. I hated kidney stuff, okay? But I think why we would think that this is some intrinsic renal thing, as in like something intrinsic to the kidney has gone wrong, is because the kidney is clearly not doing its job, right? Because this is a person who does not have enough volume of blood, or like something is wrong. But I'll be going now. Have a great stream. Okay, bye. Something is wrong. It should be trying to hold in water, but it's not. So hence something's wrong with the kidney itself, and it's not that there's not enough blood getting to the kidney, or there's not enough fluid in the body, or something like that. I don't know. Kidneys are confusing. Kidneys are confusing. Can I get to a point where it can't really dissolve and tries to send it through anyway? If the stuff in that your kidneys are trying to into your bladder can't dissolve, that's one of the ways you can get kidney stones. That's literally what kidney stones are. It's like, it's not dissolving. Well, yeah, basically. That's how I would think about it. Then you become a bird. Well, yeah, because birds don't really pee or poop, right? They do some weird in-between thing. Yeah, they do some weird in-between thing. So it's like their white bird poop is also bird pee. It's like pee and poo together. Okay, a 32-year-old man presents with several weeks of progressive headache, confusion, and low-grade fever. That's not good. Yeah, too high of a concentration, so it forms crystals, chemistry type shit. Yeah, something like that. It's not all kidney stones are like that, but yeah, a lot of kidney stones are like that, I think. Uric acid is gout and stuff. No, uric acid is gout, yeah. Man, I do not know if I could do doctordle for molecular biology. What would that even look like? Doctordle for molecular biology. Wouldn't that just be like a general PhD exam? like the general, like, oh, what is the describe transcription? I don't know. Okay, so fever makes me think infection. Fever makes me think infection. Confusion and headache makes me think something is going on with like the brain part. Because like confusion can just be from like a really bad infection, but then a headache is like a little strange. So like maybe he has literally a brain infection. Which meningitis? Like, do we think he has... Let's see. Meningitis. Oh, you'd have to specify which one. I don't know. Okay, that's... Well, that would be more... Okay, so classically, if this was like a college-age person who's living in a dorm, then I would be much more concerned for meningitis. Like classically, like college-age students that are close together, especially if some of them aren't vaccinated, it's like a classic situation for meningitis. There's been a lot of situations where people have died. I don't think it's a UTI though. Maybe encephalitis. Oh, it could be encephalitis. This is just so vague. Several weeks of progressive headache. Confusion. You have caused confusion and delay. I've caused myself confusion and delay. Headache, progressive headache, confusion, and low-grade fever. Honestly, that's just how I feel every day. That's just how I feel all the time. Progressive. This is just me with a migraine. Yeah, it could be almost anything. Yeah, I'm just like... Confusion. I'm confused. I'm always confused. Confusion. Headache. I don't know. Like a venous thrombosis? You know what? We're going with this. Okay, no. He has a history of You should have started with that. You should have started with that. He has a history of HIV? Oh my god, he has a history of HIV and his most recent CD4 count was 85? My god, burying the lead, literally. Infection. That changes things. I know. Oh my god. Okay, guys, for reference, when we're taught how to give like a presentation on a patient, often the way it's often like they talk about this thing called the one-liner, right? Which is, I have a age, sex, like 32-year-old man, right? I have an age, sex with past medical history of relevant past medical history, and then whatever other relevant stuff, presenting with blah 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 for XYZ time, right? That's like your not chief complaint. Chief complaint is like this for this person would just be like headache or something, but it's like the one liner. So you notice how past medical history is in there. So if you would want this, should be on the first line. Come on, this isn't how we're taught how to think about things. It's not like headache, go, you know. 32-year-old man with a history of HIV and a recent CD4 count of 85 presents with several weeks of progressive headache, confusion, and low-grade fever. That's a full sentence. That's something you can do something with. I don't know if I could do something with that, because I think because I'm subconsciously extremely terrified of infections, and I've read a lot about like the history of AIDS, it's just makes me really sad. So anyways, saline will not fix this. Yeah, no, I don't think CD4 of 85 is good. No, it's not. And that's not good. So could it be like HSV? HSV meningitis, HSV encephalitis. Are you afraid of infections the way Phi is of prions? I'm afraid of prions too. Prions are Creutzfeldt-Jakob disease. Oh my god, terrifying. Bro, why are you not scared of prions? It's contagious dementia. Like think about it. Contagious in like a horrible way. Contagious fast dementia. Isn't that terrifying? As a concept, that's terrifying. I will also say, personally, maybe this is because I'm a psychiatrist, one of my greatest fears in life is getting really bad dementia. Like Alzheimer's, or like I don't know. There's just something really scary about that. Not scary because very infrequent. Stroke is scary after 50. Okay, it's different though. Like, it's not something I'm scared of in like a, I'm afraid this will happen to me. It's scary in like a, just as a thing that exists and could happen to anyone. It's scary. Resistant to almost anything, even an autoclave, and killing that stuff. That's the thing. Yeah. Prions are basically like misfolded proteins that make your body misfold your proteins also, right? And then your brain dies. Like I don't really have a great way of explaining this other than that's very scary. I had to do a spinal tap on someone we didn't know had CJD. Oh my god. That's terrifying. Protein C, protein do. Yeah, exactly. The protein goes like, oh, you're in that shape? I will also be in that shape. This is the wrong shape. Oh, too late. I'm in this shape. Oh no, this shape causes dementia. Too bad. Prions are cosmic horror, but not a personal existential horror, I think. Yes, correct. The same reason my headphones get tangled in your pocket is why prion disease is a thing. Yes, pretty much. Well, if statistics are comforting to you, I don't know if statistics are comforting to me. Yeah, I don't know if statistics are comforting to me, personally speaking. But I think that's correct. Prions are like cosmic horror. Prions are like religious horror almost, you know? It's like there's something, yeah, no, there's something very about that, you know? Again, just contagious dementia. Like I just especially because like so many things, a lot of things aren't really contagious. You know, a lot of the scary diseases, in my opinion, are not contagious. Or like like infectious diseases are crazy in a weird way. There's an order to them, but it's wrong. Okay, let's see. Is it this? No. Does this person have a stroke? Neurologic exam reveals focal deficits, including left-sided weakness and difficulty with speech. So I had a stroke? Oh, shit. What is that called? Is it... This? No. Oh! Yay! I got it! Okay, I'll explain. I'll explain. I'll explain my thought process. How do I explain my thought process here? Okay. He has HIV, focal deficits. I was like, I don't know, is it some kind of like HSV virus? Hello, Lev, I'm Ice. Wait, toxo can give symptoms of stroke? Well, okay, symptoms of stroke. Actually, sorry, I didn't think about it enough. It's not a stroke. Okay, I should have... Guys, I wasn't thinking properly. This should have made me think not a stroke. Obviously, I didn't write stroke at any point, but like I was like thinking about it and I was like, this doesn't actually make sense, I don't think. So basically a stroke is either blood vessel leaks in brain, which leads to blood in places it's not supposed to be in your brain, and then that part of your brain goes and dies. Well, not dies necessarily, it depends, but it goes and it's not good, right? Because it's both inflamed and also because the blood is spilling out of the blood vessel, it's not going where it's supposed to go. So there's parts of your brain that's not getting oxygen. The other way that the stroke happens is that like some blood vessel in your brain gets blocked, right? And so then there's no blood going to where it's supposed to go, and that place doesn't get any oxygen. Then it also starts to go and like dies, right? So either way, it's pretty localized. Like think of it as like a car crash or like a bridge collapsing or something. Like it's going to cause problems in the area where that happened. So because we have a general understanding of the anatomy of the human brain, different kinds of deficits tend to happen together depending on where the stroke is in the brain, right? In this case, though, something has damaged the right side of the brain because it's left-sided weakness, but also the left side of the brain because the left side of the brain usually is where speech stuff is. This isn't the case for every single person, but the left speech, both understanding speech and producing speech, occurs on the left side of the brain for almost everyone. It's not true for literally everyone, but it's true for almost everyone, right? So what this means is that like something has gone wrong with the right side of the brain and the left side of the brain. So it's probably not a stroke because most people aren't going to have strokes in two parts of their brain at the same time. So this is not strictly lateralized. Yeah, exactly. So that's supposed to make you think like, oh, it's probably not a stroke. It's something neurological. It's probably something infectious because this person has HIV, which means that they're very susceptible to infections. And there's a lot of different infectious shit that you can get with HIV and AIDS that goes to the brain. PML is something HIV related in the brain that I don't remember exactly. And then, you know, he has multiple pet cats. So toxoplasmosis, Toxoplasma gondii is a parasite. It's a cat parasite. This is part of the reason why they tell pregnant women to not scoop cat poo. Right? Because if you get infected with toxoplasma while you're pregnant, it can then infect your fetus and they can cause like really bad birth defects, right? But yeah, classically cat litter could have toxoplasma. It's like unlikely if it's indoor cats that have never been outdoors and have never encountered other cats outdoors, but you know, it can happen. And so basically what happens is like this parasite in particular, the eggs go to your brain. It's a pretty intriguing set of brain deficits and a very interesting explanation. Yes. Thank you. Are strokes near the corpus callosum super uncommon? So for anyone who's confused, the corpus callosum is the big like freeway highway connection that connects the right and left parts of your brain. It's like down the center of your brain that connects the two parts, both physically and in terms of like informationally connection. I don't know that that's necessarily uncommon, but the thing is that the corpus callosum isn't function, it's communication, right? It's a little bit different. It's the center of the walnut. Yeah, it's the center of the walnut, right? Because people have had their corpus callosums like cut and they can still function, right? It's because it's not that how do I put this? Yeah, it's like it's there's communication problems. It's like the highway is gone, but the two factories are still working and they can still use their local roads, you know, for epilepsy. Yeah. Some people have such bad seizures, have had such bad seizures that they get the connection between their left and right brain cut. Because if that's cut, then a seizure that's starting in some part of the brain can't develop and encompass the entire brain. Okay. First time here. Hi, Greg. Gregory Battis, CFA. Is CFA an accounting thing? At work, but just want to drop in and say hi, Lev. Okay, back to work. Have a good stream. Okay, bye. Passant. You know, if I say that fast enough, it makes me think en passant, like the pawn thing you can do in chess. Bro, the first time someone did that to me in chess club, I was like, that's cheating. Are we just making up rules now? And then they're like, no, that's a rule. That's a thing that you can do. And I was like, oh my God, I hate this. I feel like the first time that you get like en passanted in chess, it feels like being gate kept. It's very like, oh, you like Batman? Well, tell me about this issue from the 1980s and who drew it or something. Yeah, en passant is funny the first time. It feels like cheating. Because I feel like the first person doesn't know. Same with castling. Oh yeah. No, when we were on a vacation, my husband and I did like outdoor chess, like in a park, and we hadn't played chess against each other really before. And I castled, and he was like, "What is this? This is cheating." CFA is finance. I was correct. Okay, some kind of money thing. I'm doing med-related studies at the moment. Ooh, congratulations. What are you doing? The only obscure move I know is the castle. Yeah, no, me too. I can castle. I always forget how en passant actually technically works. I'm always like, I think I can do it. And then I look it up and it's like, no, you can't. Why do you get to move two pieces? I know that's literally what it feels like. Like my husband was like, Lev, what? What are you doing? Like, what? How did you just... That's cheating. And he was like, well, I want to do that. And I was like, you can't. Because you moved those pieces already. He was like, that's not fair. And I was like, well, life isn't fair. Castling is a made-up rule. The whole game is made up. I mean, this is true. Everything is made up. All of this is made up. We made up everything. But that doesn't mean it's not real. Just because it's made up doesn't mean it's not real. It's called cheating. Deal with it. Literally. Wait, I'm so proud of myself. I got this one. I got this one on my own. Oh, guys, am I smart? Oh, God. A 26-year-old man is brought to the emergency department by his family for agitation. PCP. Okay, it's not true. Oh, this is psych. Bro, this is my thing. His family reports he was recently discharged from a psychiatric facility after hospitalization for an unknown cause. An unknown cause? Hello? I'm sorry. I'm just gonna get onto a soapbox real quick. My soapbox is that no one should be leaving the hospital without being able to articulate why the doctors think they were in the hospital. Maybe the doctors don't know for sure, right? But like, I feel like even in the most confusing cases, there's gotta be some sort of like, this is what we think happened, right? This is what you should watch out for, right? Like, I feel like I don't like it. I really feel like it's a disservice to everyone if someone is leaving the hospital and they and their family are like, no idea what happened. No clue. Unless it's like genuinely like a medical mystery, like you had a fever of unknown origin. You know, we have absolutely no idea. But like, you should know all the things they think it's not, right? Because if doctors are super confused and they don't know what it is, it's probably because they tried to figure out if it was a bunch of different things and it wasn't those things. So then you should know what it isn't. Does that make sense? Right? It's like, oh, you had a fever. We don't know what caused it, but we tested for all of these other things that are common reasons for why someone would have a fever, and you didn't have those. So, go follow up with a rheumatologist or something like that. I don't know. But anyways, hospitalization for an unknown cause. Why was he hospitalized? Also, even if you don't know what exactly caused it, there's a reason for hospitalization. You're not just like, you don't take like a totally unremarkable person and just throw them into a psychiatric hospital. Like, something happened, right? It's like unknown cause. Okay, yes. He like Mad Men, right? Like, he like chopped his nipple off for no clear reason. Like, something happened. Do I know why? No, but something weird happened. Otherwise they wouldn't have been going to a psychiatric hospital. Okay, I feel like this is like very rage baity for me as a doctor. This is very rage baity because it's like, we're just not going to give you the information. I'm just like, come on. I don't know how you could possibly get things right on the first try for any of these. I put down PCP intoxication because person shows up to the emergency department agitated is often intoxication. And then classically, this is just, I don't even know physiologically why this happens. But people that are really high on PCP like become like Superman, you know? First of all, it can make people really angry. And second of all, it can make people like weirdly strong. Like, it bypasses your like natural like limiting of your physical ability, right? Like, we tend to not actually use 100% of our strength because we know it could hurt us. But for some reason, people on PCP like that's like lift a car, like tear a pane of glass off the wall and throw it through the window sort of like strength. So anyways, PCP intoxication is what it made me think of. I didn't think that was actually the answer. I just, so take PCP to be strong. It doesn't actually make you strong. It just makes you not care if you're hurting yourself. This is a joke. Don't worry. It better be. I can imagine there's a lot of broken knuckles of PCP users. I mean, probably. I don't treat broken knuckles though, so I wouldn't know. Okay, I don't know. Bipolar disorder, agitation can be a lot of different things. If he's 25 is around the age that you start to see like first big presentations for some of the classic psychiatric illnesses like bipolar disorder and schizophrenia. Or schizoaffective, which is like in the middle, but that's not something that a lay person needs to know. Oh my god, they have schizophreniform on here? No one uses that as an actual diagnosis. No one. Okay, I shouldn't speak too definitively, but rarely does anyone use that as a diagnosis. He is unable to answer questions and appears to be in acute distress. That's not helpful. New alpha male plus PCP usage trend. This VTuber told me that PCP will let me make my muscles operate 100%. Kika, don't curse me with this. Oh my god, please don't. I don't want to get in trouble. Do not. Okay, to be clear, PCP, don't use PCP. Okay, it's not a fun time. Catatonic? Could be catatonic, but he's aged. I guess it could be. Sorry, I tend to see hypoactive catatonia. Oh, they don't even have catatonia on here. Weird. Huh. It could have been catatonia. From what I can find, schizophreniform is basically long-term schizophrenia. Other way around. Schizophreniform is what we call someone who has had schizophrenic type symptoms, but for less than 6 months. Which it's almost like it's not its own diagnosis. I honestly don't really see it. I will only use PCP when it would be the funniest. No. Please, it's not funny. Don't use PCP. Meningioma? Actually, yeah, it could be some kind of neuro, like really classic neuro thing that's just looking like psych, because this also happens. Meningioma. Is a what is the time frame of meningioma? A 25-year-old. Unable to answer questions, appears to be in acute distress. Because it could be some kind of weird tumor situation. Honestly, who knows what the tumor does. This is my thing. I feel like we don't understand enough about the brain to be able to say like, oh, this tumor definitely would not cause XYZ. This is my feeling, but I'm not a neurologist. So if you're a neurologist, don't kill me. Unable to answer questions and appears to be in acute distress. I don't know. I don't know. Is he bipolar? Is he epilepsy? I guess he could be epileptic. Epilepsy. That seems unlikely though. The symptoms are not too specific, right? I'm just like, is he paranoid? But they say it's not scary. It's paranoid personality. I don't think that's right. Mixed state with heavy anxiety. I mean, could be bipolar. Let's see. Bipolar 1. No. Oh, shit. Fever, diaphoresis, muscle rigidity, and tachycardia. Oh, is this NMS? Yeah, okay. All right. Okay, I just wanted to make sure my diagnosis was correct before I answered it. Yay, we got NMS. It's a side effect of a medication they gave him at the hospital. This is very rare, to be clear. The really, really scary side effects, like not even side effect, like death effects of psych medications. There's two that we think of, and serotonin syndrome, which is too much serotonin, and then there's NMS, which is also called neuroleptic malignant syndrome. Neuroleptic is an old word for antipsychotics. Yeah, okay. So basically, NMS is a really, 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 really bad, life-threatening effect that can happen with antipsychotics, especially like usually it's typically considered dose dependent. That's why we have like dose limits for antipsychotics. And it's more likely usually, I think, with like older antipsychotics, what we call first generation antipsychotics. What I will say though is I've never seen it. I've never seen NMS in my life. I've never seen serotonin syndrome either. So it's really rare. But classically, it causes a fever, and it causes what we call lead pipe rigidity, right? Which is this muscle rigidity. Serotonin syndrome, yeah, main reason you shouldn't mix certain drugs prescribed or treat with MAOIs or SSRIs. I guess this functions the same way with antipsychotics. It's different. It's a different syndrome. Serotonin syndrome, they don't get rigid in the same way. They get hyperreflexic. It's like the classic differentiating feature. They also get feverish though. It's like someone who's on like a lot of psych drugs who's feverish is like a classic, like what is going on? Is it serotonin syndrome or NMS? Like test question. The big thing is NMS causes rigidity, lead pipe rigidity, like they feel like a lead pipe. I don't know why lead pipe specifically, but you know, whatever. And then SSRIs causes hyperreflexia, like serotonin syndrome causes hyperreflexia. Sorry, not SSRIs. SSRIs, which is things like Zoloft, Prozac, Lexapro, those are brand names, are newer antidepressants, are less likely to cause serotonin syndrome. So it's become a lot rarer. It was, I think serotonin syndrome was a bigger concern and a lot more common back with much older antidepressants like your tricyclics and your MAOIs. Yeah, like there's an old antidepressant where like you can't eat things that have a lot of tyramine in it, so like aged cheeses, wines, and fava beans, because it can cause like toxicities and stuff, and that's like less of a thing now. It's much more rare. I've never seen it. I've never seen serotonin syndrome. Not actually. I've seen it like maybe it's serotonin syndrome and then the person turns out to have some horrible infection. It is still important to know though. It's still important to know because they're more for serotonin syndrome actually. There's a lot of medications out there that can increase the serotonin in your body that aren't like antidepressants or even just psychiatric medicines at all. Like there's some antibiotics that can increase the serotonin in your body just because it's just a thing that it does also while being an antibiotic. The classic one is linezolid. But yeah. No, these interactions are important to know because they're like really weird. Especially like neurotransmitters, like our bodies are trying to be efficient, right? So the same molecule does a million different things depending on where in the body it is. So just like indiscriminately increasing some molecule in your body is like almost never leads to just one thing happening. This was fun. The contraindications, they weave such tangled webs. I know. Okay. A 16-year-old girl presents with episodic lower abdominal pain, nausea, fatigue, and occasional loose stools that have caused her to miss school multiple times. Is this like functional or is this IBS? No. Episodes occur approximately once per month, each lasting 48 to 72 hours before resolving spontaneously. Is this imperforate hymen? Oh no, she has, okay. They peak within the first day, so she is having menses. Sorry, is it just primary dysmenorrhea? Okay. Guys, I did it! Period. I mean, yeah, it's period. I figured it out. I overthought it. Hi, Levy. Hi, Kel. I overthought it, okay? Okay, I was like, if they don't mention her... Okay, I will say, look, if all you saw is these first two things, I was like, I feel like... Okay, let me explain. Let me explain my thought process, okay? So... 16-year-old girl, episodic lower abdominal pain, loose stools, blah, blah, blah. Okay, obviously my first thought is going to be like IBS, right? Because we're focusing on this abdomen pain and stools. But then it's like, it's not IBS. I'm like, okay. And so it's once per month. The girl in once per month made me go period. No, it made me go period too. This is why I got confused. Once per month made me think period. But like this made me think like, oh, is she like not getting her period? Because what an imperforate hymen is that it's like, well, the hymen is not perforated basically. So this was in the pit, I think. There was one patient in the pit that had imperforate hymen. It's not a big deal, but it's basically like if the entrance to your vagina was like actually like sealed shut because the hymen never like split, right? So you can imagine that you will start getting your period and it will just start filling with blood. But because the hymen isn't perforated, it's imperforate, it'll just collect inside of you. There's no opening for flow to go. Yeah, exactly. So it's like she is having her period, but it's not coming out. And that's why it hurts and it hurts and it hurts, right? Because there's just old blood that's like stuck there, and it will hurt more and more and more over time. 16-year-old is probably around the age that I would expect, especially given that menses, like the start of their menstrual cycle, is starting earlier and earlier in girls now. So 16, it would be like late to have not had your period yet. So in any case, the classic test taking thing, right, is if they don't say it in the question, it didn't happen. And I think it's weird to go 16-year-old girl, episodic abdominal pain that happens once a month, lasting 48 to 72 hours. I'm like, okay, is it her period? Is it related to, I feel like you would have already said it was related to her period if it was her period. Anyways, if it's imperforate hymen, why would the pain go away spontaneously? Usually the pain does go in like ebbs and flows, right? Because the flow itself causes a lot of problems and then your body like gets used to it. Bum, 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 bum. Or something like that. I don't know. I'm pretty sure you can go through several cycles with imperforate hymen before it gets like so bad that you're having continuous symptoms. I'm pretty sure. Because the classic sign is that you do an exam and you see like violaceous blood, several months of old violaceous blood or something. It's like a keyword. Anyways. But she is having her period. Either way, it's definitely period related. Yeah, primary dysmenorrhea. Dis as in like dysfunction, menorrhea as in period, basically. Wow, guys, it's like I know things. Oh my god. Fucking charcuterie Marie Tooth syndrome. I cannot believe that was the question for today. Charcot-Marie Tooth syndrome. Jesus Christ. That's not fair. Primary dysmenorrhea, you need NSAIDs, basically like ibuprofen. Sorry, charcuterie board syndrome. That's how I feel. The syndrome of the charcuterie board. Pew, 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 pew. Oh, thank you for the hydration reminder. I will need to pee soon though. Oh, wee wee. Okay. 40-year-old man presents because of a new onset headache. I don't know, man. Is he having a stroke? Let's just say it's cluster headache. Nope. Start 4 hours ago. Exacerbated by light as well as movement. Is it a migraine? No. Once again, HIV. Why do people keep... Why do these... Why... Question. Why does the doctordle not tell you that they have HIV until like 3 things in? Toxoplasma. No, it's not toxo. Prescribe LSD? That's a terrible idea. I don't think I can prescribe LSD. Technically, like, ketamine treatments are a thing for... Not even technically, but, you know, they let the resident go in first before the attending. Good kipti. First time I've ever heard the word charcuterie board hit my eardrums. You've never heard that before? Charcuterie board? No one reads the EMT's OPQRST anymore. I mean, apparently not. I'm like, guys, where's my information? Is this what it feels like to be an attending? Is this what it feels like to be an attending, getting like report from a med student who's on their first rotation and they've never interviewed someone in this setting before, and so they're like, okay, what is your past medical history? You didn't mention they have HIV. That changes everything. What's his CD4? That's my question. If someone is saying to me this is a patient with HIV, I'm like, okay, are they seeing someone for that? Are they in a clinic? Are they getting tested? Are they on ART, like antiretrovirals? What is their CD4 count? Like those are all things that you just like need to know if someone says this patient has HIV. Even in psych, I want to know that. Guys, I'm tired. The patient remembers something they didn't tell the resident, and the resident has a look on their face. I swear they didn't say that, and I asked. Honestly, yeah, no, that happens all the time. I feel like it happens when med students go in before residents. It happens when residents go in before the attending. It's just like people, like, maybe it's just the way that the question is phrased. If you're less experienced, I think is one thing I've seen. And the other thing is that sometimes just like the patient just has to sit on it for a little bit more before they're like, oh wait, no, yeah, I have had surgeries before. Shit, sorry, I forgot. Okay. He has not been able to afford his medications for many years. I mean, did he have a stroke? Oh, this is like specific. You have to choose which kind of ischemic stroke it is. Oh, fuck that. I'm not doing that. Passage of time usually brings up people's memories. No, it's true. Especially like boredom tends to bring out people's like thoughts more, right? Like when you ask someone questions really fast, their answers are often going to be like not as thought out. But if you leave them in a room for a little bit and you're like, think about it. Oftentimes they'll genuinely remember something they had forgotten. Oh God, why am I hiccuping? Why am I hiccuping? He has the hiccups. I have the hiccups. Type 2 diabetes, hypertension, and HIV. You have diabetes. Meningitis. I don't think it's... Actually, it could be meningitis. Is it meningitis? Is it? But started 4 hours ago? Like acute onset headache in someone exacerbated by light as well as movement. So is it like a intracranial pressure thing? Probably, right? Meningitis? Okay, but what kind of meningitis? HSV meningitis? I'm pretty sure like group B listeria, like those are really young and really old, so I don't think it's this guy. Neisseria meningococcal meningitis is that's the one that's usually college age students, I believe. Or is it pneumococcal? I don't remember. Is it this? No. Okay, well, he's definitely infected with something. He has a temperature of 101.3, a heart rate of 97, and a blood pressure of 108/72. Untreated HIV makes herpes more possible than the rest. No, that's what I thought, yeah. But, okay, is it encephalitis then? HSV. Encephalitis? No. Nuchal rigidity. So it is meningitis. Okay, it's some other kind of meningitis. Is it what? God, I already forgot. Frick. I forgot. What is the nuchal rigidity is a classic sign for meningitis. What is the... I always forget that HIV changes the meninges be itis. I mean, that is actually, yeah, itis as in irritated or inflamed. The meninges do be itises. Is it Neisseria? Is it Listeria? I don't know. I would think strep. Well, okay, group B strep or strep pneumo. There's two kinds of strep here. I don't know. Is E. coli meningitis a thing? I know it's not on here, but E. coli meningitis. It is a thing. Okay. Could have picked up pneumonia from another clinical setting. That's true. Okay. Nope. A lumbar puncture reveals an elevated opening pressure and an India ink stain shows encapsulated yeast cells. Oh God, what is this called? What is this called? Is this okay, well, is it tuberculosis? I feel like with HIV it's always tuberculosis. Or no, it is definitely meningitis. I don't know why I'm it's definitely meningitis of some kind. So weird fungus. I mean, this is the thing. It's like, it's gotta be some kind of weird sorry. It's gotta be some kind of weird fungus situation. So is it like a TB meningitis? I don't know. I don't know. Let's just say tuberculosis. Nope. Cryptococcus neoformans. Oh! Okay, this is unfair. Sorry. It wasn't included in the list of meningitises. It's definitely a meningitis, but they just didn't call it a meningitis. I know what cryptococcus is! Sorry, I'm upset. Meningoencephalitis? Okay, because it's meningoencephalitis. Okay, I'm upset. This is why I don't like questions like this. A meningitis by another name. I'm like, I'm upset. I'm upset. This is upsetting to me. Why didn't they include it in meningitis? Right? Right! That's what I was wondering. There's an Anki tag for this? What is this? Copies a pre-made tag. Can instantly pull up relevant cards tied to the current doctoral case for targeted step 1 or step 2 review. Oh, God. And I guess meningitis encephalitis. Well, you're on the right track. We were definitely on the right track. This brain shit. I feel like this is a conspiracy. I feel like this is a conspiracy against me specifically. Against me being happy. So we're leaving that. We're leaving that behind. Okay. We're leaving that behind and we're going back to we're doing this. Bum, 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 bum. Okay, let's change our lighting effects then. Dum, bum. Golden hour. So maybe a little too golden, no? Let's do this one. That's still too bright. Okay, I think this is good. Dum bum 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 bum. All right, guys. I'm tired. My brain is tired. Ask me different questions. Ask me no questions and I'll tell you no lies. Except I will tell you lies because I love lying for fun and for profit. Lying for fun and profit is good, actually. JK, don't do that, please. Eepy. I'm Eepy. Yeah. Now I'm tired after doing all that. I don't even know how many I did. Like 5? Yeah. I did 5. I feel like I could say I got 3 of them. So that's not terrible. Oh no, it's 5:40 in the morning? I don't want a morning. It's 5:40 in the morning for you? Why are you awake? Go to sleep. Lying for fun and profit. So you lied to us when you said not to do PCP? No, I did not lie to you when I said not to do PCP. You shouldn't do PCP. It's bad for you, probably. I've never done it, so I can't speak from personal experience. But I've not heard good things. That's what I'll say. I have not heard good things. Thank you for the check-ins. Okay. But what if that was a lie? Well, you never know. You can't trust anyone on the internet. Why does it... I was trying to drink water and my V-Bridger was like, you're sticking your tongue out. I'm like, I'm not sticking my tongue out. I'm trying to drink water. Myelin is nap time. No, not nap time. Not yet. Not for you, at least. You're not allowed. You're not allowed to ever go to sleep ever again. I did woke up and would you look at that? A Discord pop-up gone into my feed. Okay, well that you can choose to ignore that pop-up. Right? You can choose to ignore that pop-up, okay? It's for your information. I didn't force you to click on anything, okay? I'm streaming when I'm able to, when I have time. I had to like strip apart my entire office to redo the setup so that I can like put my new computer, not my new computer, my new monitor on my desk and connect it to the other thing and the other thing and the other thing. And my goodness, it not only took a long time to do, it was like, I don't know. It's hard. It hurts. I don't want to be crawling around underneath my desk anymore, but I think I probably have to because I feel like the setup still isn't quite right. But in any case, I had to reset up everything, which is why I couldn't stream until the time that I opened stream. Okay. And I still have more stuff to set up. I have another like little monitor that was my old second monitor that doesn't work that well, but it's like, it still is another monitor, you know? So it's like nice to have. I need to set up my webcam for work also. Guys, why is life so hard? Anyways. Anyways, what I was going to talk about really briefly is some of the stuff that I was thinking about doing for stream. Let me get my, 1 second. I have a notebook. Well, I have multiple notebooks. Excuse me as I die. I have a notebook. And I'm really excited about it because the notebook is pink. And I found a pen online that is a dual color pen. So it has a pink side and a green side. And I was like, that was made for me. So anyways, in my pink notebook with my pink and green pen, I write about stream. I have a couple of ideas. I have one on like, which I might actually just do as a scripted video. I think it could be fun. Like how to improve, like how to break down a song and learn how to sing it without needing to know how to read music. Which is a long title. So I was like, maybe I should do like, give me 10 minutes and I'll improve your singing or something. And I'll make you good at karaoke or something. I don't know. We'll see. Maybe I'll write the video first and come up with the title later. But I think it could be good as a scripted thing. Because basically, like, I'm someone who likes talking about the principles of things, like breaking things down into principles and teaching it that way, as opposed to teaching like very specific things, right? I think understanding the principles that underlie an understanding of a concept is way more helpful than like in the specific scenario, do this, you know? In any case, I was thinking about like how that works for singing and like how I think about, like when I learn songs for covers or just listen to songs generally and sing them to myself, and how you get from like a very basic understanding of a song to a more like thorough understanding, right? Oh, Sarticus. Oh, like Spartacus. Thank you for the follow. So that's sort of a thing, you know, like how you go from like da da da, like how do I, what's a good example? Oh, A B C D, like A B C D E F G to like A B C D E F G, like, you know, like what are the things that you're thinking of, that you're adding to knowing the melody, so that it sounds more like how you want it to sound like. What are the things that you can try to notice about how you are singing if you're listening to yourself singing that could explain why it doesn't sound the same as the person who's singing it officially? That's also a terrible title for a video. I'm not good at this. Ah, well, I suppose I'll figure it out eventually. But that's sort of a thing, right? Like the length of a note and the emphasis of a note and time signatures and legato versus staccato and like slurring of notes, you know? Do 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 ba da ba. Do Oh, we're in ads. Oh, on Friday, the stream that I'm planning on doing is just life advice. If I end up streaming on Friday, we'll see if I end up having time. I might not be able to. Ad time. Yes, it is ad time. Ad time. It's time for there to be ads. Ad time. I once sang a JoJo opera song for my last art project. It was fun. A JoJo opera song? What's a JoJo opera song? Learning to project your voice is fascinating. I know, it's hard. Still, I'm not very good at it. Like, I don't think I'm very good at projecting my voice, if I'm being completely honest. Dum, ba, dum, dum. It's the theme for Caesar Zappelli's death, FY. Oh, interesting. Caesar's death made me cry, I will say. Oh my gosh. You know, it's been so long since I've watched JoJo. I don't know, where did I stop? I think I stopped with part 4. I think part 4 is where I stopped. Yeah, I think so. Because I did not get to Giovanni. You know, there's a famous I think there's a famous like EDM person called Giovanni Giorgio, who's I guess also a JoJo. He's really cool. They reference him in like a Daft Punk song. I think it's literally called Giorgio. Ba, 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 ba. You know what's interesting? So much has changed about my stream since I first debuted almost a year ago, and the background music has not. The background music is like the one thing that has not changed at all. It's like never changed. Like this current background, this like Chinese pavilion-esque looking background, this is what I started with, but I did change to other things for a while and then come back to this, you know. Oh wait, the angle of the sun on me right now is not correct. Hold on. Hold on. Where is the direction? Okay. There we go. See, now it's more consistent. Oh wow, isn't that cool? What? Okay. I think that's cool. Look at that. Now the lighting is consistent. Nice, right? Wow. It almost looks like I'm like in the setting now. Wow. I'm almost like one of those cool people that has like cool lighting effects for their model. And like, anyways, I think it's cool. I think it looks cool. Yay. And then I have the background blurred a little bit so it looks extra like there's depth of field, you know? It's cool. Yes, 950 brain cells well spent. 950? Was it that many? You know, I never really know how to price anything for channel points. It's almost like you know what you're doing, LMAO. I know, right? It's almost like I've been doing this for almost a year. It's almost like I'm good with technology. It's almost like technology and being good with technology is, well, okay, being good with technology is not the right way to put it. I like messing around with software. Am I good at it? No. Technology also hates, like, hardware. Hates me with a passion. Do I know why? No. Oh, okay. Well, before I was rudely interrupted by a barrel roll, hardware hates me, and I don't know why. Okay, all I know is that every phone that I've ever had, I only ever changed because it broke. Okay, I've never intentionally been like, you know what? I think this laptop, computer, phone, headphone, piece of any technology basically, I've never been like, you know what, I need to upgrade. You know, it's getting kind of slow. I think it would be nice to have something new. No, every single thing I've ever upgraded has been because the last thing died. Seriously. And it's always like earlier than it should, which is the problem. It's like I'm not even trying to like use things until they die. They just die. And it's always some like incomprehensible, like my phone turned off and then just never turned on again. No preamble. It wasn't slowing down. It wasn't glitching out, nothing. It just one day was like, no more. No more for me. Thanks. I'm done with that. I'm done with life, actually. I would like to stop. I would like to go to the great beyond and no longer have to deal with you. No jail, Sag. Look, the jailing chatter is on a gotcha, okay? There's a lot of things that are on a gotcha. You could also accidentally jail yourself. So... But yeah, for some reason people try to jail me and I'm like, why are people trying to jail me? I don't even know if you could jail. Can you jail me? I don't think so. Like, could you jail the streamer? That just seems like not super plausible. Green apple keeps the technology. It's not even a green apple a day, just a green apple period. Just green apple period. Is jail a ban? It's a 10-minute timeout. Or I'm pretty sure it's a 10-minute time. It's not a ban. It's not a ban. It's just a timeout in chat. It just means they can't chat for a little bit. It might not even be 10 minutes. I don't even remember how long I made it. But I would never put bans on a gotcha. Oh my god. Seems like that seems not nice. And you know me, I try to be nice. Usually. Most of the time. Am I nice? I don't know. I don't know if I'm a nice person. I like don't... What does that even mean, you know? What does it mean to be a nice person? Who knows? Yeah, cannot ban or time out broadcaster. I mean, that would make sense. Right? How in the world would you time out the person who's streaming? Okay, wait, sorry. I was talking about stream ideas. So this is my other thing is, do we like hand cams? Like, do we want hand cams? Because I could do them. I have gloves. I know I've like shown my actual hands before, but like I don't like showing them if I can help it. So I think I would wear gloves, to be honest. It also like helps with like grip and stuff, because I was thinking I could do a Warhammer painting stream at some point if people were interested in that. And I could also do like a journaling stream, because I've gotten really into like stationery and journaling and stuff. So like a techo kaigi or something could be fun. Or like how I plan things. Ooh, yeah, continuing the Necrons. Yeah, I'm working on a monolith right now. Because so this is just for people who speak Warhammer real quick. If you're into Warhammer, please listen. If you're not, just bear with me for a second. But I play Necrons, and for my 2000 point army, I want to play with the monolith because I really like Hypercrypt Legion as the detachment. I just think it's a lot of fun, and to be able to make the most use of its stratagems, you kind of need a monolith, it seems like. So I'm painting a monolith. It's hard because it's big. What? You play Warhammer 40k? Yes, I do. I do. I literally went to Games Workshop yesterday. Was it yesterday, actually? Maybe the day before yesterday? I don't even remember anymore. Can't believe my Kamiyoshi plays Warhammer. Oh my gosh, am I your Kamiyoshi? Ah! They're cool. Gloves, good idea. The streamer that does figure painting, calligraphy around these parts, if you want some pointers. I'd love some pointers, because the thing is that I have a document camera type thing, but I just feel like the quality isn't that great. I feel like the quality could be better. So I did get a webcam recently, but I'm not sure how to set it up for like a hand cam, you know? I've got models, but haven't figured everything out. Which models did you get? Which models did you get? Did you get Space Marines? Everyone plays Space Marines. You want to build Space Marines? You want to build Space Marines? You want to play Space? Everyone plays Space Marines. Space Marines are boring. Play Tau. The one that looks like Voltron. Or be like me and play Necrons. The objectively best faction. I love Necrons. I just think they're so cool. The books are cool. The lore is cool. It's also, they're just so very psychological, you know? Guard. Ooh, a few Lehman Roost tanks are Rogel Dorn and some art. Imperial Guard is confusing to me. I don't understand it. But good luck with that. I just like the monsters, okay? I like them. I like Necrons. I like Tyranids. I like orcs. I like Nurglings. Like, I just think that, like, you know, I think those are so fun. Guards are underrated. Guards? Imperial Guard? I've heard is I don't know. I'm not experienced in Warhammer, to be clear. I've been playing for like 3 months. For 3 months. Basically, yeet the soldiers at horrors beyond comprehension. I mean, yeah, pretty much. For the Imperium. The problem also with getting into Warhammer, and this is the last thing that I'll say for those of us who are not fans of Warhammer, is that Warhammer 40k, Warhammer 40,000 is like it's like 40,000 years in the future, right? Like it's very like techno-y, even though there are a lot of monsters. Age of Sigmar is like the Warhammer verse timeline that's more like fantasy oriented, with like magic and stuff. And my god, those models are pretty. They're so pretty. Oh my gosh, like a person who's like doing water magic and like on the top of a wave, and it's all colorful and oh, it's so pretty. They look so good. I don't know if I want to learn a whole other thing, and I don't really want to play it. Only in death does duty end. Yeah, that's the thing that the Space Marines say. They're not religious at all. It's just really funny to me that they're like, we've got rid of all religion, but also if you don't believe in our god, king, emperor, you are a heretic. And they're just like, let's just co-opt all of this religious imagery, like all of it, like even the names of things. And then we're like, actually, but we got rid of religion, so it's not religion. It's just, he just actually is our God King, you know, the emperor, the immortality, the heresy, the you only in death does duty end. No, you see, it's different because it's true. No, exactly. Like, it's not religion because our God is real. And it's like, TBH, I kind of like the lore more than the actual game since it's expensive as hell for me. That's true. It is a pricey hobby, especially if you like really want to get into it. But it's still fun. Like, I feel like there's plenty of people who don't like play. They just do paint or they just are in the lore or whatever. I think that's also fine. I've been reading some of the books too. I recommend The Twice Dead King. I haven't finished it. I'm almost done with the first book. But it's really good so far. Towering golden figure that is immortal. I am not a god. I am your king emperor person that you must worship, otherwise it's heresy. Like, come on. Come on. Also, y'all need to remind me. Sorry. That was a little burp. Y'all need to remind me to what's it called? You need to remind me to use my toggles, because you know what I should have used today that I forgot? This toggle. I should have used this toggle and I forgot. You need to remind me to use these things. Or this one. Sorry, I'm saying this like it's your fault. I need to remember to do these things. There is a 40k game where you build your army of fight similar to tabletop. I'll look up the name, post it in either your or the Feethier in Discord. Okay, I know there's like video games and stuff like Rogue Trader or whatever. There's a lot of video games. Space Marines, Space Marines, the Space Marines. Lev, use your toggles. Okay, thank you. See, like I paid money for this. Why am I not using it? I'm upset. See, I even have this nice toggle. Oh, this is the other thing I need help with. How do I, like, what should I do with this toggle? It makes my quadient, like, light up, but I don't know. I don't know what that should mean or what I should do with that, but... Like the mobile game? It could be the mobile game. I really am not familiar. Okay, let's see. In any case, it is about time for Lev to go and eat dinner. So let's see, who should we raid? Blue is streaming. Oh, Echolas is streaming. Arby is streaming. He's playing Elden Ring. Ooh. Oh, what is this V Gala thing? I see multiple people streaming it. You turn into an apple. Bony wait, what? What? Bony head? Who? Who, what, when, why, where, how? Post it into Lev's lobby on VTheorem. Thank you. I will take a look. Yeah, do you guys know what VGala is? People seem to be... Is this like a RP server? Oh, it's a Minecraft thing. Ah, naruhodo ne. Naruhodo ne. Never heard of it. Well, let's raid into someone doing it, because I think some of my friends are doing it. You guys can report back. I've only played Minecraft like the one time. It was hard because I don't know how to play Minecraft. But oh, oops, that was not intentional. Sorry. I don't know why I hit cancel. Apologies. Yeah, no, because I think Atlan was in our stream a little bit and it made me go a little bit like, oh my god, hi. Because I've watched him before. I don't usually watch Minecraft streams though, so maybe we'll raid and I'll watch a little bit of a Minecraft stream so that I can like learn, you know, because I've only played Minecraft for all of like 2 hours. No, 6 hours, and all I did was dig a really big hole, and I didn't know you were supposed to add torches, and then I died because of monsters. And I made a house that looked like a mushroom, but then my house also died because of monsters. And it was very sad. So that was my Minecraft experience. I think I would need someone to hold my hand if I was gonna play Minecraft. Okay guys, I love you all. I will see you hopefully on Friday, and yeah, we'll do some like advice stuff. Thank you so much for a really fun stream. Bye. 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 Bye.